Hi, how are you? My name is Fauzia. I'm an ophthalmologist, particularly eye doctor. I'm a cataract surgeon. I work at Healthgate Hospital as the main ophthalmologist here, and we do all kind of treatment here in this hospital. The thing to if I might talk about something that is actually pressing the community that much, the way you have seen it, you find 80% of the people are wearing spectacles, just like me, and one of the things is because of the reduced vision. And the community needs to understand what is the reduced vision, what causes this reduced vision. So I would like to just have a bit of a touch on that. So reduced vision has many causes, particularly. So it is one of the things we need to understand first is what is reduced vision. Reduced vision is, from the human perspective, what we see as if I see you, it is reflected in my eye in light form, and then it goes to a place called in the eye called retina. So that retina is now where the information is being translated into now a human being is what you are seeing, or even any object or any other thing. So reduced vision happens most of the time because of light not focusing very well into the retina due to problem of the curvature or the shape of the eye. Maybe there's part of the eye that is called cornea and lens. So when there is a bit of problem there at the curvature, so the light doesn't land on the retina. Either it can land before the retina or behind the retina, and that causes a bit of, now someone is not able to see that well. So what causes these things? There are many causes of this reduced vision. One of the things is hereditary. Yeah, it could be something you are born family-wise, in their lineage there's that problem, so it is being carried forward to the next generation. The other one is because of let's say a refractive error, as in someone developing difficulty or reduced vision along the way, and this can be maybe a child who was born premature because the retina was not mature enough. So as they grow, the adaptation or all those things can cause refractive error. The other thing can be diseases that someone was born with, like in kids who are born with Down syndrome, they have that, a condition that is genetical, or as in a child who has autism and many other conditions that someone is born with, chromosomal defects can cause that. The other one is eye diseases. Let's say like in our community there's a lot of allergy. This allergy, the more someone itches the eye, it causes now as in deformed curvature of the cornea, so that causes refractive error. Or something like cataract. Cataract is another, it's like opacity of the lens. So it is, in a way, though it is something that can be corrected and that, but in a way it causes also that reduced vision. The other thing is glaucoma. Glaucoma, unfortunately, most of the time, if it is a nerve issue, when it causes damage, someone is not able to see. So that also causes reduced vision. The other thing that causes reduced vision is, there are many causes, but those are just but few of them. And then types, particularly if we focus on the refractive error, there are types of refractive error. There's something called, I think in layman they normally call it, I'm not able to see that far-sightedness, and that is hyperopia. Yeah, I think if I'm not wrong. And then hyperopia is when you are able to see something far, but you can't able to see something near. Yeah, so that is hyperopia. And then there's something called myopia. Myopia is you're able to see something near, but you can't see something far. And then there is something also called another condition called astigmatism. Astigmatism is a condition whereby the curvature of the lens or the cornea is affected, so the light that goes into your eye bends in the wrong way, so someone is not able to see that well. And then there is something called presbyopia. Presbyopia is an old age condition where by the age of 40 you find majority of the people are not able to see something near them. So you find people using reading glasses most of the time with that condition. Unfortunately, it is not something can be treated that frequently with any other form. Mostly, preferably, is the reading glasses, which is easier and reachable for people. So how do we treat this refractive error? There are many ways of treating this refractive error, and one of them is through glasses. We give glasses to this kind of patient. We do proper examination and give them the appropriate glass for it. Then the other one is we do refractive surgery, like you do, like in form of cataract. You remove the lens, you put a new lens in the eye, intraocular lens, where someone is able to see. So while you are putting on that lens, you focus on the lenses that can treat these refractive errors that can do that. Or there is even something called laser surgery, like there is LASIK, PRK, and many other. In developed countries, you find that many other forms of treating these refractive errors. So there are other conditions that are a bit very hard to be treated. If you find something called keratoconus, that is like the curvature of the cornea is changed so much, so you find this patient might need changing of that, like you do corneal transplant for it to correct the refractive error. And the other one is, let's say, like something like glaucoma. Glaucoma is a nerve issue where if the nerve is damaged, there's no way like you can do glasses or anything or any other surgery that can reverse the damage, but we can prevent further damage with like many medications that can be given so that you reduce that pressure of the eye to reduce more damage. Or you can also give glaucoma surgery where you can reduce that damage. So based on that, our community needs to really understand that you don't do self-medication. You just don't go to any person on the way, because eye is very sensitive. Most of the things that happen to eye can get reversed back. So it's good to go and seek proper medical consultation so that you're able to be given proper treatment for the condition that you have, and get educated about the condition you have so that you can go along with your doctor and be able to be at par with what is going on with your life. See that?
Yes.
Yes?